My name is Sydney Jackson, and this is my partner Ashley, and we are going to be presenting on labor and delivery nurses. So, starting out, understanding the career, labor and delivery nurses assist pregnant women through childbirth and postpartum experiences. They administer medications such as epidurals and assist physicians and midwives with the actual birth. Some qualifications are you must graduate from a nursing program, and then after you graduate, pass the NCLEX exam. Another educational requirement is that you be educated in neonatal resuscitation and fetal monitoring. Skills that you will need are compassion, patience, leadership, and self-confidence. The typical salary is between $52,000 and $111,000, with the mean being around $70,000. Scheduling varies between each nurse depending on your position and whether or not you're a part-time nurse or not. Pathways to advancement are becoming a nurse practitioner or becoming a certified nurse midwife or earning varying certifications. Some challenges of the position are high-risk patients, babies that don't latch, so those are babies that aren't able to breastfeed, deaths of both mothers and babies, and the emotions that come with those deaths.
And then, so for pros and cons of being a labor and delivery nurse, a pro is obviously the salary. For Minnesota, it's around $78,000, but it really depends on how much experience you have in the field. The scheduling is pretty flexible. Some choose to do the 12-hour shift model, which is where they work 3 days and then have 4 days off. So some choose to work in chunks, which is you could do Monday, Tuesday, Wednesday, and then have the following off. And then for weekends and holidays, it's rotational, meaning that you don't have to work every weekend or every holiday. It just depends. And then for the times, if you do the 12-hour shift model, it's pretty much any combination of 12-hour shifts. And then continuing, for advancement opportunities in healthcare, it's pretty common to advance. And so nurses with labor and delivery backgrounds can pursue a variety of other roles, some of which include being an administrator, a lactation consultant, and a perinatal educator. And then they can also obtain their graduate degrees in order to seek advancement practice positions, including a clinical nurse specialist, a CNM, which is a certified nurse midwife, or a women's health nurse practitioner. And then full-time is the most common, although there is part-time shifts available. And then some cons is that it's just a high-stress job and you really have to be on top of your game. For opportunities in this career field, nursing careers are always in need and the industry is constantly growing. So for the job outlook, there's an increase of around 15% from 2016 to 2026. And labor and delivery nurses usually work in hospitals, clinics, or birthing centers. And then for 4 jobs I found to apply for, the first one was titled RN Labor and Delivery, which is through Fairview Health Services, which is located in Minneapolis, Minnesota. They support both low-risk and high-risk pregnancies and births. They provide families with the knowledge and skills to achieve their goals, as well as recognize the importance of families feeling empowered in their care and their expectations at birth. And then for Why Apply, they have a lot of benefits such as PTO, health, dental, and vision insurance. And then for the second job I found was Registered Nurse Labor and Delivery Unit, which is through Avera Marshall, located in Minneapolis, Minnesota. They promote daily health and social needs for future families. For Why Apply, the all scheduled positions include every 3rd weekend and 1 summer and 1 winter holiday rotation. For the third, it's RN labor and delivery / antepartum, They're committed to helping patients as well as each other, provide comfort and educate new families. The company is Regions Hospital, which is located in St. Paul, Minnesota. For why apply, their company is very diverse and welcoming. And then for the fourth one, RN Labor and Delivery, which is through Allina Health in St. Paul. They help administer medications, assist with childbirth, and educate new families. For why apply, it's close to home, being located in the cities.
Is this you? Me?
Oh, is it me? I don't know. Well, for the RN Labor and Delivery for Fairview, the requirements are in Minnesota RN license, 1 year in labor and delivery in the past 3 years, basic life support. For skills, you need to be supportive, have strong communication skills and leadership, and then something that you can do at CSP here is be in the Ignite Leadership Program. For required documents, didn't say anything, but I'm assuming you would need some sort of resume. For the second one, for Avera Marshall, your requirements are to be a Minnesota registered nurse. For skills, you need to have strong communication with team and patients, be willing to work in fast-paced environments, and you have to be sincere. And you would also need a resume. And then for the third one, for Regions, requirements is have a Minnesota licensed RN degree, a BSA or master's in nursing. For skills, you have to be flexible, be able to adapt, and be willing to work independently and in a team setting. Again, you would need a resume. And then for RN Labor and Delivery at Allina, the requirements is to have a BSA in nursing, a current RN licensure for Minnesota, and basic life support. For skills, you need to have good leadership skills, good ethics, and then good communication skills.
Okay, so for job research, like I said before, the duties of a nurse, labor and delivery nurse, are to administer medications such as a epidural or other necessary vaccines. Make sure your patient is comfortable, although labor is not necessarily comfortable. Help with the delivery of the baby and make sure the baby and mother are okay immediately after birth. Like I said before, the work schedule varies. There are morning, evening, and night shifts usually. The person we interviewed said that there are usually about 8.5-hour shifts, and that extra half hour is overlapping with the next shift of nurses. The benefits, such as healthcare benefits, depend on what kind of employee you are. So part-time and full-time have different benefits. So more information on being a labor and delivery nurse at Fairview. This is a healthcare company. Like Ashley said, there's always a demand for nursing positions, and there's room to grow through further education and certifications, such as becoming a midwife or nurse practitioner. For the position as a registered nurse at the labor and delivery unit at Avera Marshall, this is a regional medical center, and like I said before, there's always demand for this position and always room to grow. And for the position as a labor and delivery nurse at Regions Hospital, this is a teaching hospital. This is actually the hospital that our interviewee worked at, and as a labor and delivery nurse. And lastly, a labor and delivery nurse at Allina Health. This is another healthcare company. There's, like I said before, always a demand for this position and room to grow. So for our informational interview, As I mentioned before, she was a labor and delivery nurse at Regents Hospital. Her name is Ellen Brown, and she was actually the labor and delivery nurse that was in the room when I was born. So she is actually a former labor and delivery nurse at Regents Hospital, and she is a current patient care supervisor in maternal fetal medicine department at M Health Fairview. So essentially, she is a manager in that department. She started out her nursing career as a patient care technician, so pretty much just doing IVs and little chores around the hospital. She worked in all throughout the hospital, so she got to see all of the different departments and see where she wanted to actually work when she became a nurse. For her undergrad degree, she was actually an athlete at the University of Minnesota. She knew that she wanted to go into nursing school, but as an athlete, they told her that she would not have enough time to do clinicals and such, so she wasn't able to get her nursing degree during her undergrad. So instead, she got a business degree and later went back to nursing school and got a 2-year degree. The way nursing has affected her life outlook is she has empathy for everybody she meets. She is very kind and caring and always wants to help. And she says that nursing is just a part of who she is. She's been a nurse for so long that she cannot see herself in any other position. For when asked about dealing with an unsatisfied patient, she said that this is a very common occurrence, so it's something that we'd have to get used to as a labor and delivery nurse. And her advice was to talk openly and work to build trust with the patient and be very, very patient and ask questions to make sure that you are making the patient comfortable. When asked about the hours, she said they varied based on her position. So through her career as a labor and delivery nurse, she worked as part-time and full-time. So her hours depended just on what position she was in. The most important quality, she said, was she put an emphasis on being an advocate for the patient, being very confident in yourself, and having a questioning attitude while also staying professional at the same time. So doing things like making sure that the physicians and midwives are doing what they're supposed to be doing and what the patient needs. Also having compassion, individuality, so treating each patient as an individual and their own person, because everybody is different in many different ways. So we need to treat them accordingly. And lastly, empathy. Her biggest piece of advice was not taking no for an answer. She wished she had pushed harder during her undergrad to be able to get her nursing degree and work something out with her athletic and academic schedules. What she liked about being a labor and delivery nurse was building the relationships with the many different patients every day, working with her colleagues to make sure that the patients were getting the best care possible, and also working with physicians and midwives. What she disliked about being a labor and delivery nurse were that the highs were really high and the lows were really low. So things like death of a baby, so a stillborn baby, or death of a mother during childbirth was very devastating. And she said, if we want to go into this career, we have to be prepared for things like that. The typical day for a nurse, a labor and delivery nurse, she said, started off by discussing patient information with prior nurses. So that goes back to the overlap that happened with the nurses that were working on the shift before. So our major takeaways were the coolest story that she told us and most interesting and heartwarming story was that she had a patient that was in labor, and she was in a coma, non-responsive, not doing very well. They didn't think that she could hear or understand anything, but as she went in to give her medications and change her IVs and such, she was just talking to her and letting her know that she was being taken care of and everything was going to be okay. And later, when the woman woke up from the coma, she told Ellen, our interviewee, that she heard everything she said and she really appreciated her kind words in that scary time. She told her how scared she was and how much her words helped her in that time. The most concerning thing was that we have to be prepared to deal with death and stillborn babies and the death of mothers and such. That's something that's really emotionally takes a toll on you emotionally. So it's kind of concerning that as the years go on towards being a nurse, we have to prepare for things like that. And that is the end of our presentation. Thank you for listening.